235 to the Secretary, Division of Health, Wellness and Social Protection.
Assemblyman B. Israel.
Thank you, Madam Presiding Officer. As it relates to the Roxborough Hospital, can the Secretary indicate whether the hospital is operating on a 24-hour basis? I would like to start, Madam Presiding Officer, by sincerely thanking the staff at the Roxborough Health Facility for the continued superb work that they have been doing since we've been able to actually open and provide services at that facility. I want to make it pellucidly clear to the public that at this point, the Roxborough Health Facility is not open 24/7, and I have said that on multiple occasions, and I would say that I would probably be I would be the first person to scream it from a mountaintop the day that the Roxborough Health Facility is opened 24/7. So at this point, the answer is no, Madam Presiding Officer.
Assemblyman Morris, follow up.
After 2 years, 24 months, and perhaps about 100,000 man-hours, can the Secretary indicate why we are still without this service? What is the reason? Is it funding? Is it lack of political will and leadership?
Question,
why can't the people of the East be able to get equal access as the people in the West?
Question,
in terms of
Assemblyman Morris.
Why are the people in the East currently not able to benefit from the promised 24-hour service that was the original intent of that Roxborough Hospital? Why?
Assemblyman B. Israel.
Thank you, Madam Presiding Officer. Good point. Madam Presiding Officer, as someone who born and grew and resides in the East, it is still disappointing that even after July 2019, when the Prime Minister, Dr. Keith Christopher Rowley, came up and did the sod turning, and still after January 2021, when the said Prime Minister came up and officially opened the hospital facility with equipment that I understand was simply borrowed for that day and returned to wherever they came from, probably the next day. And since, Madam Presiding Officer, after coming in to this position, and after having, for example, the Secretary with responsibility for health, wellness, and family development in 2021 indicate that all sorts of services were happening at the health facility. And after, Madam Presiding Officer, coming in and recognizing that even after all of that, the building that was constructed was not purpose-built. And because it was not purpose-built, Madam Presiding Officer, when we thought that we could have just run in and start the services, we recognized, Madam Presiding Officer, that when we had to go to the pharmacy board to get the pharmacy part of it certified and the lab board to get the lab part of it certified and all of the other areas to get those certified, Madam Presiding Officer, We recognized that the actual spaces were not designed in a manner that allowed those entities to provide the kind of certification that those national agencies required.
Assemblyman B. Israel, unfortunately, you have about 1 more minute to wrap up this question for the 45 minutes total period for questions to secretaries.
So thank you, Madam Presiding Officer. Given all of that, and given the fact that we had to go back and retrofit, we had to go back and, in some instances, move walls, we had to go back and identify the pieces of equipment that some of them were just sitting there and had to re-certify them and all of that. We are at the point now, Madam Presiding Officer, where we are able to provide the health center services, as in moving the primary care services into the health facility. Outpatient services are currently there. Accident and emergency services are available from 7 a.m. to 7 p.m. and we started that with a couple days and have been expanding as we go along. And we now are in essence test running inpatient services, Madam Presiding Officer. The point is to ensure that when the services are available, they are the best for the people of the East.